I'm Dr. Roger Greenwood, the longest serving kidney doctor in the Trust. This is my colleague Siobhan Doyle. We're going to talk about a new programme that started at our Trust, sending people home with their own kidney machines, home dialysis. Now, we changed our minds at the list. It's been brewing for quite a long time, realising that dialysing people inside hospital 3 times a week doesn't quite deliver as much as we thought it did 15, 20 years ago. And whilst it maintains good health and longevity, for those who really want to get even fitter and better, they have to dialyse much more than we can deliver 3 times a week. And what stimulated us to change was the advent of a new type of dialysis machine. You see, this is a much smaller gadget. It's very clever, not as clever as Peter's big machine, but this was developed in the United States, and I saw this about 7 years ago, and I was determined that whenever it left the United States, the first place it came to was Stevenage, and that's what happened.
We had the first portable machines in the unit. This is Marina and Bob, and our staff, Sibby and Tracy, hard at work, and as soon as the patients come into the unit, then they're encouraged to start setting up their own machines and learning the workings of them. And the actual training time takes about 4 to 6 weeks before they can go home confident in being able to manage their own dialysis. But obviously the training period depends on the patient, and it may be longer for some people. Now, next stage, the company that make the machine were very keen on the fact that we were wanting to use their machine, and they brought their nurse Kay over for training, to train the trainer. So she was there for 2 months to train us to get up to the expertise that we needed to do to be able to train patients from then onwards. And this is Marina, happy with her machine at the time. Now Bob, he's one of our most laid-back patients, and during training it can get quite arduous, and he's having a little kip there in between training sessions. Meet Trevor. Now Trevor was Mr. Europe 2005. He's a very unusual renal patient. His life was going very well. He bought a gym. Because he was winning competitions, people were coming into his gym. He was a personal trainer, and he was doing very well. But unfortunately, he developed renal failure. As you can see, he's got very large muscle mass there. He needs a lot of dialysis. And within the confines of the unit and the timetable that we have, he wasn't able to have the amount of dialysis that he really needed for his body size. He wasn't coping very well, although you can see he's trying to smile there, and his work was suffering because he couldn't put the hours in that he needed to as a self-employed man. So Trevor was one of the first patients to come to us to ask to do home dialysis. He could see the advantages that it would have for him, and you can see here he is training to do a standard dialysis machine at home, and there's Paul, our technician, teaching him some of the intricacies of the machine. So 2 months later, Trevor's back winning competitions, and people are flocking to his gym. He's very pleased he's got his life back. He can work his timetable and his dialysis around the things that he needs to do, and he says his life has changed completely. Now this is Lisa. She's another one of our patients, and I would like to say that all of the patients that we have trained, and we're up to number 11 now, just in the training period, are all very pleased with the way that it can change their life. When it's snowing, they don't have to worry about doing their dialysis. Some patients were travelling 2 hours to the Lister Hospital for treatment, and then they were waiting 3 hours on the machine and then travelling 2 hours back. So you can see it's quite a long chunk out of your week. Thank you very much for your time.